Dr. Brawley, I saw this report about the top 10 causes of death for Black men, and it listed, as you said earlier, uh, heart disease is number one, cancer is listed as number two. I was surprised by number three, and you tell me if this is borne out by the data you've seen. It has Alzheimer's disease as number three, and stroke is number four. I was a little surprised by that ranking of Alzheimer's as three and stroke as four. Is that what the data really shows?
Yes, unfortunately, the there's also, by the way, a link between Alzheimer's disease and diabetes, which is rampant in the Black community as well. But yes, that is what it shows. Now, with Alzheimer's disease, we don't have a preventative yet. However, again, I just said it's linked to diabetes, which is linked to a lot of social issues, and it's important. And this is another reason why people don't want to go to the doctor. Sometimes when we start talking, it sounds like we're blaming them for some issues. A lot of these are social issues that cause, for example, the obesity epidemic in the Black community. We tell people eat 5 to 9 servings of fruits and vegetables per day. Well, many people live in food deserts where there are no grocery stores, or food swamps where all the stores that sell food sell lousy food. If you live in many of the inner cities, I live in Baltimore, many of the stores they don't carry fresh fruits and vegetables. There are no chain grocery stores. They're mom and pop places that have canned goods and have other things that don't spoil. And those are terrible foods for people to be eating. Processed foods tend to be very high in calories and terrible in nutrition. And these are all setups for obesity and a number of those diseases, cardiovascular disease that you just talked about.
Yeah. So, okay. So thank you. Alzheimer is number three. They have stroke as number four, and then horribly, number five on this list is homicide, which is, that's just crazy. But then diabetes shows up as number six, and then number seven is chronic lower respiratory disease. What would that be? That chronic lower respiratory disease?
It's chronic lower respiratory disease. You and I know of it as bronchitis and emphysema.
Oh, okay. Then they have kidney. Hypertension. Very shocking to me. It's number 10.
Now, some of these diseases cross over. Okay. The most common cause of kidney disease in the United States is actually diabetes. And hypertension and diabetes is a real, they come together and really help us have kidney disease. Most common cause of stroke is hypertension. And so some of these things can sort of overlap. They all have, if you go back to, smoking, and that three-legged stool I was talking about, too many calories consumed, not enough exercise, and then storing those calories as obesity, energy imbalance. You get rid of a lot. You really start preventing or reducing risk is a better term for a lot of these diseases. And much of this starts in childhood, teen years, and it's a life of bad eating and smoking that causes a stroke in a 55-year-old or a 60-year-old, or causes diabetes in somebody who's 40 or 50 years old. It's not, and the other thing, of course, is it's never too late to start doing the right thing. Doing the right thing frequently requires several years in order for you to start seeing good results. And I also started out by saying many people are in a social position where these things happen to them, not because they want them to happen to them, but because they have no control.
So, doctor, we've seen Ozempic and other weight loss medications, Wegovy, and some others in the news a lot, obviously related to, high-profile celebrities like Oprah Winfrey and others. But I haven't seen these medications talked about in the context too much of men. What I've seen has always been literally like women, who want to be thin, want to wear certain kinds of clothing, want, their bodies to look a certain way. And health gets thrown in there too. But a lot of it seems to be about, physical appearance. Are we seeing these weight loss medications being prescribed at the same rate as they are for women, for men, or maybe they're even being prescribed more and we're just not seeing the men in these ads or in the pop culture? So
Yeah,
with men and weight loss medications.
Interestingly, I just saw a Wegovy commercial, and the shocking thing was the lead actor, and it was a black man, and that it shocked me. It shocked me. One of the problems with these new drugs, and we've only had these drugs for 6 to 8 years, so we don't know what the long-term effects are going to be. But we do know two things. The first is they're incredibly expensive, and many insurances will not pay for them. They cost $1,000 to $1,500 per month, and many insurances will not pay for them. Sometimes people will have co-pays, 20% co-pays, and for many of us, $300 a month for a $1,500 drug is still quite expensive.
Right.
The other issue that we already know is that if you stop taking these drugs, people start gaining weight again.
Mm-hmm.
And so people who go on these have to stay on them long term. And then the other issue is we don't know what 20 years of taking any of these drugs means to an individual, because we've not had those drugs for 20 years.
So to answer my question, are we seeing fewer men be diagnosed, these drugs being diagnosed for fewer men, or is it not really a difference between men and women?
We're seeing fewer men get these drugs prescribed, and the part of that is what we've been talking about. Men don't go to the doctor.
Okay.
You have to go to the doctor to get a script.
Another thing I'm starting to hear a lot of folks talk about is being pre-diabetic.
Mm-hmm.
What does that mean? And is there, if you are pre-diabetic, does that mean you should be on any kind of medication to manage your diabetes? Or maybe you don't have diabetes if you're pre-diabetic.
Pre-diabetes is not diabetes yet, but it is the path to diabetes. Mm-hmm. These are people who, and we have blood tests that tell us that you're not normal, but you're not diabetic yet. And someone who is pre-diabetic, the figures are, if someone's diagnosed with pre-diabetes, generally they will become diabetic within 10 years, unless they do something radical to change. And that involves diet, weight loss, weightlifting. Exercise is good. Weightlifting, that exercise is really, really good. Building muscle mass, which actually helps to absorb blood sugar. The CDC and others have said we should use prediabetes as a warning sign, and then heavily coach that individual to try to prevent them from developing diabetes. We have a much better chance of preventing someone from becoming diabetic if we catch them before they get pre-diabetic. And then if we catch them when they're pre-diabetic, we can still prevent diabetes. But once they develop diabetes, it is very rare that they undevelop diabetes.
Can you live, barring something unforeseen, if you have diabetes and hypertension and you choose not to take medication? Can you live a long life, not treating diabetes or hypertension?
It is possible. It's not likely to happen. Someone who has diabetes, who then starts a very low sugar diet, high in protein, lots of exercise, you can get some distance from that. But the problem is, if I have 100 people who have diabetes who are 60 years old, I can tell you over the next 20 years, a goodly number are going to end up having kidney disease because of their diabetes and end up with dialysis or kidney failure and die. A goodly number are going to go blind because of diabetic retinopathy. A goodly number are going to have strokes. A goodly number are going to have heart attacks. A goodly number are going to lose limbs because of vascular disease. If I treat the diabetic, and the treatment can include a number of pills that are advertised and some that are not, as well as these injections that we were just talking about. And if I can encourage some weight loss, I can lower the risk, not to zero. I can lower the risk of all of those bad things happening. And that's one of the reasons why we like to see everybody see a doctor once a year and have a sort of health coach to help with these sorts of things if one is pre-diabetic or on the road toward diabetes, or if they have diabetes, get it actually treated.
What's the connection, doctor, between diabetes and then having a heart attack?
Okay. When people have high blood sugar, they end up having the old folks used to call it hardening of the arteries.
Right.
We collect cholesterol plaques in the coronary arteries. These are the small blood vessels that provide blood to the heart muscle. And literally a heart attack is when one of those arteries gets clogged and blood can't flow through the artery. The muscle that would have gotten the blood flow and the oxygen, but now does not get blood flow and oxygen because of the clog, dies. That's what a heart attack is. And we do things like angioplasty, which is literally this is plumbing. Angioplasty is literally a roto-rooter procedure to actually clear that clog
Hold
out.
that thought for me, doctor. I do want you to further explain this connection between diabetes and a heart attack. I also want to talk about supplements and herbal treatments that a lot of people use in lieu of going to their doctors.